Our next speaker is someone I'd like to introduce to the stage, Dr. Rachel Abedi, who will be talking about mental health challenges in the Muslim community. So, a quick introduction to Dr. Rachel. She's a child and adolescent psychotherapist and associate lecturer at the Tavistock and Portman NHS Foundation Trust. Her academic background consists of a Postgraduate Diploma in Psychoanalytic infant observational studies and a Professional Doctorate in child and adolescent psychoanalytic psychotherapy. She's also the director of Reflection Network, which aims to improve access to mental health services for Muslim children. She will be joining us to discuss her research in light of modern Muslim mental health challenges. So I'd like to invite Dr. Rachel to the stage.
Assalamu alaikum, everyone. Thank you very much, Lauren, for having me. Just taking a moment after that very moving talk. So, for mine, I suppose, turning our minds now from the conflicts and the distress and the tragedies happening in Gaza to thinking about children and young people experiencing difficulties and distress here in the UK. For today, I was thinking about, the big questions, the title of the conference, and I was thinking about, what are the big questions in terms of my work, and I decided to go with this, which is actually a title that I used when I spoke to a secular gathering not long ago.
I'm so sorry, Rachel. Would you mind speaking closer to the mic?
A bit louder? Okay, sorry. This is a title I used when I spoke to a non-faith related gathering of people working in the child mental health profession not long ago. But I decided to go with it. What's faith got to do with it? To us here today, I'm sure it's very obvious. But the profession I'm from and the training I've had is not at all obvious. And that's part of the problem. It's a notoriously secular profession, psychotherapy, particularly psychoanalytic psychotherapy, and that extends, of course, to child and adolescent psychotherapy. So my background and my training is in that field, and I have a professional background in NHS child and adolescent mental health services. And as you mentioned, I teach at the Tavistock and to people who are training to be child psychotherapists, and I'm also an active researcher. And a Muslim. So throughout my training and my work, I've always been thinking, how do I integrate and understand my work as a Muslim? And can we have the next slide, please? Which slide? Is that one better? Better? Yeah, okay. So, is someone here? Shall I do it? There we go. Okay. This is actually a real sign that I found in a hospital in South London. Couldn't resist it, I'm sorry. There's no escape. It's important. We have to think about these things in our professions. This is our life. So, my training included the opportunity to do a professional doctorate, and I was really interested in the NHS CAMS service where I was working in Hammersmith in central London. Why was it that we didn't seem to be seeing very many Muslim children and young people referred, although we were in an area which had a high percentage of Muslim children? So you would expect there to be more referrals. Could it be that Muslim children and young people had far fewer mental health difficulties? Could it be that they were turning elsewhere for support? But why did we be not seeing more? And actually, why were we not collecting any data about this? Might surprise you to know that in adult mental health services, they do collect data. about by faith group. In child mental health services in this country, they don't. So I then sort of thought, how can I integrate this? How can I do some research in this area that would be meaningful? And I mean, the next slide really. This one, it's funny how when I'm in a gathering of Muslims, it doesn't seem as important to have to spell this out. But in a gathering of a secular gathering, it's really important, because the number of times that I've had to kind of almost justify why we needed to ask the questions. And actually my research project was, how do clinicians respond to the faith identity of young Muslims in a London context? Because it was necessary to make it quite a small project. What I was really interested in is there a gap here? Can we evidence? Is there a gap in terms of accessibility of our mental health services, which are supposed to be for everyone? So, I sort of looked at the UK population statistics. As we know, the UK's second largest faith group are Muslim. More importantly, for my area of work, Muslims as a faith group have the youngest age profile. So Muslims are 13 years younger than the median in England and Wales. 1 in 12 school children in England and Wales are Muslim. And this is increasing as a percentage. However, there was some evidence that fewer Muslims are accessing mental health support. Limited evidence, there's more research needed here, by the way, but there is some evidence. However, at the time I did the research, I published it in 2020, there had already been pieces of research saying that we need to have faith and culturally sensitive support for Muslim children and young people. I then kind of looked at what I'd experienced already in the process of my training, which was the negative perceptions of Muslims I've used the kind of quite a psychotherapy term here, the ultimate other. So this is an idea that negative things about ourselves are projected into others, and we then distance ourselves and say they are the ones that have this problem. So there was a sense in the psychoanalytic literature that that's what was happening in terms of prejudice against Muslims. Since then, there have been many other reports about this, and I've got some references if anyone's interested in that. But at that time, there had already been research about the impact of this on Muslim families and young Muslims, and the complexity of it. Muslim families are more likely to be in the more deprived sectors in the UK. This varies by borough, but it is significant. There's also the impact of Prevent and to increasing marginalisation of many Muslim communities in the UK. So that resulted in many Muslim families not wanting to approach mainstream services for help. And this, I believe, is something that was happening in terms of families seeking help from their GPs and from other NHS services. And just to add to that, particular challenges faced by young British Muslims. So not only were they worried about stigma from outside communities, but also in many communities there's worry about stigma of mental health difficulties within the community. So that also impacted families asking for help and young people asking for help. Subsequently, I've spoken to many Muslim young people, including as part of this research, who sort of said, well, sometimes we might ask our parents for some help, and we might describe this as maybe anxieties or low mood, other difficulties, and parents, I think, probably not knowing how best to help and wanting to say the best for their children, might say, well, make sure you're praying. read more Quran, but they might not know beyond that how to access help for their young people. And again, since my research, there have been reports in terms of adult mental health showing that even when Muslims are referred to NHS services, they face discrimination and stigma. This is the Wolf Institute report last year. Poor completion rates for NHS talking therapies and lower recovery rates. So, in terms of my research project, I consulted with what I called advisory groups of Muslim teenagers at local schools, really to kind of help me form the interview questions for the clinicians, so that it wasn't just what I was interested in, but what might be relevant for them. I had a series of semi-structured interviews with 8 CAMHS clinicians, so psychotherapists, psychiatrists, psychologists, family therapists, and then I analysed the data with a qualitative data analysis called IPA. And the main themes that came out of it, I guess looking at it, are all anxiety related in a way. So the main one was the kind of feelings that are stirred up in the clinicians, one of whom was Muslim, by the way, the feelings that are stirred up when they're dealing with families and young people from different backgrounds, and specifically from Muslim backgrounds. And the main feeling there was anxiety. How they used, the clinician as other, that's how they used their own identities to try to understand the young person's Muslim identity. But interestingly, none of them were using a faith identity. And a kind of tension around knowledge. That's really, I think, because this group of professions, maybe we feel that we should know things. So it becomes quite difficult when we're faced with a situation where we're reminded that actually we don't know, and we need to be curious, we need to learn. For today, I think maybe most interestingly were the themes that came out of the advisory groups of young Muslims. The significance of faith identity to the individual young person. So they were very keen to say, look, this is about, it's important for clinicians to understand how I understand where I am as a Muslim at the moment, what it means to me. They were very interested in talking about whether and how being Muslim makes a difference to their mental health. For some of them, they tried to kind of separate it, but for most of them, they were saying, well, yes, it does, and it's actually really helpful that I'm Muslim because I have more resources to me to manage my mental health. For others, they said it created more of a tension for them, and they were mainly talking about, in a family context, feeling understood or not in a family context. They talked about an unspoken barrier when relating to non-Muslim professionals. And I found that I think this is something that the clinicians weren't necessarily aware of. So a clinician like myself might kind of say, yes, well, of course I've seen Muslim young people and in my sessions, and it's fine, there's no problem at all. But what the young people were saying is, well, actually, there's a major part of myself that I don't share with that professional, with that clinician, because I don't think they're going to get it. There's also fear of being categorized, yet a hope that clinicians will be curious, genuinely curious. And another thing, and again, this surprised the teachers who were present with some of these groups, that many of their young people had experienced anti-Muslim verbal abuse, sometimes on a daily basis on their way to school. But the teachers, a non-Muslim teacher in this case, was not aware of it at all. And she taught these girls, as it was, for several years, and she had no idea and was moved to tears, actually, when she heard them talking about it. I just tell you that as an indication of how young people can separate aspects of their experience when they're with people they think will not understand. So my conclusion, really it's a statement of the problem, is what happens when clinicians' anxiety meets young Muslims' expectation of not being understood. Do we even know? Do we know if they feel understood in NHS services, in CAMS? And how would we know if we don't collect or look at data by faith identity? And what can we do to improve this? So as a result of this research, I went on to join a charity called Reflection Network, and we changed the focus of the charity to look at ways of improving access to mental health support for Muslim heritage children. I'm aware that there are many colleagues who are studying and working in the field of Islamic psychology, which is kind of, I suppose, approaching some of this problem from a different angle, which is saying, well, look, the whole philosophy on which our psychology and so on in the West is based is not compatible with Muslims. I suppose Reflection Network's approach is more about using the services that exist, which are the only option, certainly the only free option that I'm aware of for many Muslim children. How can we improve those services? And actually, we sort of what we've been doing is trying various ways. So, for example, setting up in communities free mental health services so for children aged 2 to 24. And working with communities. So, for example, the El Manar Muslim Cultural Heritage Centre in North Kensington, we have a free psychotherapy service there. So, and then there's another service in Barnet that works slightly differently, but they're all now getting referrals from NHS CAMS and from family services. So there's an acknowledgement that there needs to be a faith-sensitive service, and the therapists are all Muslim themselves as well. And we work with communities, so we work with parents and what we call parent work, which is alongside individual child psychotherapy, and we do workshops and so on, but it's very much led by the community that the service is based in. We also offer training placements for Muslim therapists and work to try and increase awareness within secular services of the need for faith-aware and faith-sensitive provision, and promoting research in the field as well. The key learning for me in the 2 years I've been doing this work with Reflection Network is the importance of faith-sensitive mental health services. The most common piece of feedback I get when we're talking to families about why are you bringing your child to us rather than a mainstream service, the most common bit of feedback I get is this idea that you get me, we're on the same page. So there's something about knowing that fundamental part of yourself, in terms of your faith, is going to be valued when you come to this service, where you're actually really vulnerable. Because if you're talking about, if you're bringing a child who's got a significant, who may be depressed, who may be extremely anxious, who may have suffered abuse, intergenerational trauma, may have all manner of difficulties in that regard, it's really important to be able to trust the person you go to for help and not feel that they're going to somehow want to separate you from your faith in order to treat you. I've also learned that expectation of prejudice is a major barrier to seeking help. I hear it again and again, and I think I underestimated it when I started this work. There's a real worry that if we come to a mainstream service, who will they tell? And I think this is partly the legacy of Prevent. The need for services to be flexible and reflective. By that I mean for clinicians to think about what they bring themselves, what they're bringing in terms of their own assumptions about a family and a young person, try to be really aware of that. And the need to co-design projects in communities. For example, there are some communities where they will not want us to use the word therapy. because the connotations of that within their own community are negative. They might not want us to use the word mental health. So we have to find ways to work together to deliver support in a community appropriate way. And finishing my so we need better data, and this is why it's important to say this here in this gathering, because we also need more research, both qualitative and quantitative, particularly around children. And I'm not just saying 16 plus. So there are many Muslim therapists who work with young people aged 16 plus. There's a massive gap in terms of provision for under 16s and young children. So I would encourage any of you who are active in this field to consider research in this field to demonstrate the gap and the need for more work in this area. Thank you very much. Thank you.
Brilliant. Thank you so much, Rachel, for that really, again, insightful presentation and drawing upon your own experience in the sector and field, especially with this age gap, with this age of people that aren't really talked about very often in terms of like their mental health challenges and everything. So I'd like to invite the audience to ask any questions. I saw Dr. Omar's hand up straight away, so we'll go to you first.
Thank you so much. It's really, really great. We have a lot of crossover with children and young people. Actually, this is a selfish question because it comes back to Elsa. But what I've noticed within my peers, and I suspect is happening within adolescents and young people, is what they are witnessing right now, especially not being able to have some sort of outlet, is essentially radicalization. And I'm noticing that. And I've been in a safe space where we had talking therapy with some of the volunteers. And some of the stuff that was said, I can tell you now, if Prevent was there, they would probably have arrested them. Some of the thoughts and dark thoughts that people are having are extremely radical, and it's just clearly a consequence of what they are seeing. Because when people feel helpless, they then decide. So I just wondered, with especially the younger generation, the adolescents, the teenagers who could easily get radicalized by what they are seeing on TV, how can we work with them as a healthcare community, and how can we help them to de-radicalize or not go down that route?
Thank you. I mean, it's huge, and I just don't think it's been thought about. I think, I mean, in the wider, because I'm thinking even as an adult, how disconnected and how one can feel so disconnected from our representatives in wider society, exposed to the news and the coverage that we see, and feel that there isn't an outlet. I think that's a key thing, that there's, who can you tell? And I think that one of the and I think it's not just the young people, I think it's the parents as well. I've had parents come to me and say, look, I tell my child not to talk about this at school. I tell them not to talk about it because I'm worried they'll get reported. So young people are obviously watching the footage and very upset and very concerned. I think it's really important for parents to be able to have conversations with their children and their young people about what they're watching, and at least allow them to voice some of that within the safety of the home, but also to think with them about ways that they can voice something in a community context. I think it would be great if communities also provided spaces for young people to come together and talk about how it feels to watch and witness something and feel utterly helpless, and to pray. But I think it's important to have that voice, as you say, because otherwise that the helplessness can lead to a wish to feel powerful, and that can go along a very negative route. I agree.
Great. Amazing. Do we have one more question from the audience?
Assalamu alaikum, jazakallah for your talk. I find it really interesting. My name is Dr. Unbelieve. I've been working in the NHS for 30 years, so I know prevent has definitely made things worse, but I've been seeing these sorts of issues pre-prevent as well. That shows how old I am. I think a number of things that I, not only in my work as a clinician, I also am a chair of governors in a secondary school, and my best friend happens to be a psychotherapist, so children and adolescent mental health is what I say is my jam. I think a number of things that I've realised is that the reason that, and actually it's not only faith, it's actually our ethnic minority. There's that huge thing about them and us. And I often, when we go out and give talks to community small groups and mosques, and I think the main way we need to start is the caregivers, so the teachers, the parents, and making them understand, and from a young age, starting from reception, because we dealt with, on a casual basis, children as young as 6 with depression, who are self-harming, and as we now also are aware of identity issues as well. And I think the most important thing is to encourage those caregivers, and I've often gone out to primary schools, secondary schools, and made the teachers understand it from our perspective. And there's a lot of things that they had no idea about. So that is something that we need to push towards, and definitely encourage people collecting data. But another thing is that there is the influence of culture on all of this. Because when I was speaking to a group of sixth form teachers, one of the things that I found just through my own work is the taboo of the diagnosis of a mental health issue and future marriage prospects is massive. And they were absolutely shocked to hear this. And then this whole thing about them and us, I'm also wondering whether we as the caregivers need to sort of deal with our own taboos within us about, because working with my local talking therapies, there is this definite move towards understanding more, and thankfully it's well overdue. So there's just a few points that I wanted to make about, having that experience from not only working as a chair of governors in a secondary school, I do student voice there, so I talk to these children, and I think about them being heard. And another quick thing is about social media's influence, because there are obviously quite extreme preachers out there who say if you have a mental health issues because you lack faith, and that's another reason. And that's what parents will often say: you need to pray more, you need to do this. But I think it's about having that open dialogue. And just to finish off, I gave a talk at a mosque to a group of mothers. There must have been about 50 mothers in there, and I asked them, how many of you talk to your children? And I think when they said, yes, we talk, I said, what do you actually say? And they said, well, how was your day? And I said, do you actually say, how are you? And it transpired about 2 or 3 only spoke to their children, really. So that's just a few insights that I have.
Yeah. Alhamdulillah, I think it's great that you're doing that work, and that it's so important. With many of the communities we work with, that's where we start. You can't just go in and say, right, we're going to provide a space to talk to your child about this, that, and the other, or to hear your child. We have to work with the parents, and that's where we start. And it's so often that the parents haven't had an experience of being able to talk to someone about some of the challenges they've faced with regard to what we call mental health, emotional well-being, whatever you want to call it. They haven't been able to talk about it in their own community because of a fear. And I think there's that same fear when it comes to what a child might be exposed to on social media. And it's to try to break those barriers is to be able to try and encourage the parents to have those conversations with the children, and then say, where is their help available? Thank you.
Great, thank you all for your questions, and let's give a round of applause to Dr.